today we are going to talk about the foot. First thing we are going to do is talk about the foot anatomy, the different parts of it. Then we are going to talk about somebody's gait as well as their foot posturing, which is the positioning of your foot. Then we are going to talk about pathologies that can occur due to poor foot posturing. And lastly, we are going to talk about footwear that you can wear, specifically Nike brand today, to avoid pathologies such as plantar fasciitis. So it's really important that you learn about the feet because most everybody has them and uses them every day. They are vital to healthy living as well as having an active lifestyle, so we hope you learn a lot.
For this section of the video, we're going to be focusing on the anatomy of the foot. So one of the most important parts of the foot to look at are the two different types of arches that you have on your foot. First of all, we have the medial longitudinal arch here, and then we have the transverse arch. And the second part of the foot to look at is the plantar fascia. So the plantar fascia, if we look at first at the calcaneus, which is commonly known as the heel, we can look at the calcaneal tubercle, which is a small bump here, and then move upwards. And this is going to be a band of tissue known as the plantar fascial ligament. This ligament can become very easily inflamed if we have the improper orthotics to go with it. Another important part of the anatomy is the metatarsals. So the metatarsals are the bones that run on the anterior aspect of the foot and can be impacted based off of any changes to gait or foot posture.
Gait is the manner in which you walk. Because of this, the positioning of your feet is very important. Your feet are the beginning of the kinetic chain, so ultimately, having poor gait and foot posture can predispose you to other injuries in other parts of your body. There are many things that can mess up your gait. Two of the most popular things that do this is having high arches or flat feet. These conditions are referred to as pes cavus and pes planus. If you are pes planus, this means that your transverse arch has collapsed, making your arches flat, so when you walk, you evert your feet or you pronate them. If you are pes cavus, this means your transverse arches are higher than normal, and when you walk, you invert your feet or you supinate them. It is important to correct your foot posture so that you can keep the rest of your body healthy and aligned. In addition to your foot posture impacting your kinetic chain, your gait as a whole can impact your knees, and eventually your hips may start to sit unevenly, which can affect your posture. Foot posture is a vital part of the kinetic chain and helps determine somebody's gait.
As Ali pointed out, foot posture and gait play a large role in the kinetic chain and thus can predispose a person to certain injuries. But what injuries exactly can result from improper foot mechanics, and how can those injuries be addressed? I will touch on a few of the most common pathologies here. In the foot, pes planus or pes cavus can cause compression of the metatarsals, which results in the painful swelling of a plantar nerve. This pathology is known as Morton's neuroma. Adjusting footwear to correctly support the arch is the most effective treatment of Morton's neuroma. Posture abnormalities also cause a common pathology known as plantar fasciitis, in which the plantar fascia along the bottom of the foot are in pain during push-off and activity. Sometimes orthotics are used, along with correcting muscle imbalances through strengthening to help alleviate this injury. Pes planus is also one of the top causes of medial tibial stress syndrome, also known as shin splints. Athletes can help lessen their risk of developing shin splints by wearing supportive shoes or orthotics to lift the medial longitudinal arch of the foot, thus preventing hyperpronation. While incorrect foot posture can be the cause of many more pathologies, these are just a few of the most common. The bottom line is to be aware of your foot posture so you can best support your feet to avoid injury.
Hey guys, so welcome to Nike. We're going to be talking about a few other shoes that's going to help for plantar fasciitis. So the first one is going to be our Structure. It's going to be our Nike Structure 21, and it's going to have this dynamic support right here in the sole right here that helps for people with flatter feet. That's going to give you a little bit of an arch here on this ledge right here. And then next shoe is going to be our Vomero. Our Vomero doesn't have that added arch that this one does. This instead has a lot of padding and cushion. So it's going to have a lot of cushion on the outside as well as the inside. That's going to help out just for pain in the foot and just going to help you throughout the day.
So to wrap up our video for today, we have talked about the foot and the different components or parts of it. We've talked about different injuries of the foot and how to treat as well as prevent them. And we've also talked about the importance of gait or how you walk. So your foot shape or posturing, including your arches, can greatly impact your entire body and kinetic chain. Having good foot health and posturing is key to healthy living and an active lifestyle where your body is working to its utmost capability. And we hope that today you've learned a lot about the foot, about its injuries, how to maintain that healthy life, and remember that if you've got happy feet, life will be sweet.